evening, everyone, and welcome to the talk on understanding speech delay in children. So, today I'll be covering the following contents. First, we will see what is the importance of communication. Though it may sound like a cliche, but I thought I would touch upon this to start off my presentation, and we will see the various speech and language milestones. Then we will look into various risk factors for speech and language delay in children. Then we'll also look into causes for speech, seeing when we can say that the child has a speech and language delay. Then we'll also see why we need speech therapy and what can you do as parents. At the end, we will answer some frequently asked questions. Okay. So to begin with, let's see why is communication important. Communication is very important. Everybody knows that at this age. Um, why do we need to communicate with babies? We need to communicate with babies because it is the foundation of attachment. When the baby cries, the mother consoles the child. The mother talks to the child while feeding the child. So this forms an emotional bond, an emotional attachment with the baby, and the baby feels secure. Okay, and also language is how we get to know each other, and it is how we build relationships. So can you imagine if there was no language, if there was no communication among people, then how would we get to know what was in someone else's mind, and how they are, what they think? Okay, so language is how we get to know each other. And language is also important for learning. It is the vehicle for learning. This uh, especially becomes imperative, especially when the child starts going to school. Okay, that doesn't mean that the child doesn't learn anything before the child starts school. There is a lot of learning happening since the day the baby is born. Okay. Then communication impacts all areas of life, such as education. Education, it's very important. I already told you, and even in employment, if you have, it's a competitive world now, and if you have a very good communication skill, then only you are selected for various jobs. And communication is also very important for mental health. So if a child is not able to communicate whatever that the child is feeling, eventually there would be a lot of frustration that develops, and this frustration would lead to lot of emotional outbursts, and the child may be irritable, and the child may throw so much of temper tantrums. So if you know anybody, any child who is not talking age appropriately, you can see that the child is irritable, and the child gets very angry for small things, because all this is because of the frustration that is built up because the child is not able to communicate. So communication is very important for us as human beings. Okay. Here I would like to stress upon two aspects of speech and language. Okay. One is comprehension. Comprehension is nothing but understanding. Okay. And the other is expression, that is expressing or producing or talking. Okay, so these two are two separate things. A child who understands what you say need not talk, but suppose you tell a child, bring the pen. So the child needs to understand what is a pen, recognize what is a pen, and then bring it to you. So that is comprehension, that is understanding. So a child might have comprehension. The child might understand what you're saying, but the child may not be able to revert back and say, here, I brought the pen to you, take the pen. Okay, so but there are also instances wherein the child might have problems in both comprehension and production. Okay, there might be instances where the child's comprehension is good, but production is affected. Okay, in normal language development, comprehension precedes expression. That is, comprehension is developed first. The child understands the language first before the child starts speaking. Okay, so learning to talk is a very complex skill. It is not a very easy thing. We all assume that since we do it so effortlessly, we think that it should be a very simple skill, but actually it is not. And learning to talk is like learning to climb a ladder. So each step on the ladder represents a new set of skills. The child moves from one step to another step in this ladder of learning to talk. Okay, only when a child has learned something at the lower level, then only the child can move to a higher level. Okay, in this ladder. So now let us look into the speech milestones. Okay, speech milestones in the sense what the child has to learn at what age. Okay, so as soon as the child is born, the child cries. So that is a first attempt of communication. Okay, and whenever the child is hungry or in pain or is experiencing discomfort, the child cries. Okay, that is these are signs of communicating with the world, communicating to the mother that I am hungry, feed me, or I'm uncomfortable, or I'm in pain, etc. Okay, crying is the first way of communicating. And soon after this, children learn to vocalize, produce certain sounds, certain vowel like sounds like a, e, u, and all, around 3 months of age. And then there'll be other kinds of sounds such as squeals and gurgles that will be produced by the child. Around 6 months of age, the child will start to produce consonants and syllables like papa, baba, mama, etc. So around 6 months, the child starts vocalizing, vocalizing in the sense production of sounds such as papa, baba, mama, etc. And also, the child learns to respond with vocalization when called by name. So, if you, whatever you call your child, whether you have kept the name for the child by 6 months, or you would be calling Putta, Puttu, or whatever to the child learns to respond to name call and starts speaking something, whatever, like producing sound when his or her name is called at 6 months of age. And then around 9 to 10 months, the child starts saying first words like dada, mama, etc. And then around 10 to 11 months, the child learns to follow commands. Like if you tell the child, put that down, or you ask, where is the fan? Where is the ball? Etc. Okay. So such simple questions the child should understand by 10 to 11 months of age, and around 11 to 12 months, that is at 1 year of age, the child should be able to use or produce around three or more words with some consistency. Consistently, they start to produce three or more words by 1 year of age. And by 14 to 16 months, the child would clearly recognize various parts of the body like eyes, nose, mouth, etc. And by 18 to 20 months, that is by 1.5 years of age, the child would have a speaking vocabulary. That is, the child should be able to talk around 10 to 20 words. By 2 years of age, that is 22 to 24 months, the child should be able to understand complex sentences. Like, before this, we saw simple sentences like, put that down, and where is the fan? Where is the ball? Okay. Now, at 2 years of age, the child starts to understand complex sentences like, when I go to the store, I'll buy you ice cream. Don't cry now. So, this is a long sentence and a complex sentence. By 2 years of age, the child should be able to understand this. And in terms of production, the child must be able to produce two-word sentences consistently, and then occasionally the child would be using three-word sentences. By 33 to 36 months, the child should be able to understand prepositions such as in, on, under, and all. And the child should be able to understand three-step commands. For example, if you three-step commands in the sense like, you ask the child to come here, take the pen and give it to the father. So there are three steps to the command. So if you give it in, if you tell the child to do these three things continuously, the child should be able to do it by 3 years of age. And then also, the child must be able to relate, that is, tell you whatever the child did, whatever that happened in the recent past. Okay. Like, I was walking, I stumbled upon a stone, I fell down, I hurt my knee. Such things the child must be able to tell you in continuous sentences by about 3 years of age. By 48 to 54 months, that is 4 to 4.5 years, the child should be able to understand tenses. Okay. And the child should be able to use forward sentences and also able to narrate a story on his or her own. Okay. By 5 to 5.5 years, the child should be able to use 5 to 6 word sentences. And at this age, they start reading and writing. Okay. We have seen that the child progresses. I told you that learning to speak is like climbing the steps of a ladder. So we have seen that how child moves from a very simple level language, and it moves from one word to 2 words to 3 words to 4 words, then 5 word sentences, how it gradually moves from simple language to more complex language. So next we'll see, when do we say that the child has a speech and language delay. Okay, so I presented to you all the speech and language milestones. So if the child has not achieved these speech and language milestones, then we can say that the child has a speech and language delay. And even if you don't know these speech and language milestones, you can compare your child with the same age children, And parents would usually know when the child is not speaking appropriate to the age level. Okay, so when the child is not speaking on par with the peers, or the child has not achieved the speech and language milestones, we can say that the child has a speech and language delay. Okay, sometimes parents complain that their children have unclear speech. So this unclear speech could be because of either a delay or a pronunciation problem. So what you should do is you should consult a speech language therapist or a speech language pathologist to make sure what the problem exactly is. Okay. So let us look into the risk factors for speech and language delay. So the first risk factor is being male. That is, males are at a higher risk of communication disorders or speech and language problems than females. And also, females are faster in talking, and they are more accurate in pronunciation and their speech and language skills. And if there is a family history of speech and language difficulties, that is, if anybody in the family had a speaking problem or a hearing problem or any other communication difficulty, then there is a higher risk for the child that the child would also develop speech and language difficulties. And premature birth is also a risk factor. And consanguineous marriage, that is marrying within blood relatives, that is marrying your sister's daughter, or marrying your maternal uncle or paternal uncle, that would be a risk factor for speech and language difficulties. And having a low birth weight, so anything less than around 3 kgs would also be a risk factor. And delayed birth cry or no birth cry is also a risk factor for speech and language difficulties. So these are just risk factors. So if your child has any of these risk factors, it does not mean that your child will always develop a speech and language problem. It's just that the risk is high. Okay. Now we will see what are the causes for speech and language delay. Okay, here I'll be mentioning certain conditions with which speech and language delay occurs. Okay, first is hearing impairment. That is, if the child is not able to hear, then obviously the child cannot learn to speak. We learn to speak by hearing language. So if the child has hearing loss or is not unable to hear, in common language we call, if the child is deaf, then the child will not be able to speak also. Then if the child has autism, okay, autism is a condition where the child has difficulty in social interaction and communication, and has certain stereotypic movements, okay, like rocking like this back and forth, or making certain movements with the hands. Okay, then in such cases also the child would have a lot of difficulty with speech and language. And cerebral palsy, uh, then intellectual disabilities, means the common term for intellectual disability is mental retardation. So if the IQ of the child is less, then the child would develop speech and language problems also. And if a child suffers from any infections that damage the central nervous system, such as meningitis, encephalitis, etc., that could also cause speech and language problems. Then epilepsy is also a common cause for speech and language problems in children. And many a times there would be an unknown cause that we would not be able to pinpoint a particular cause for speech and language delay, but the child with no other problems, with uh, no other risk factors, might also develop a speech and language problem. So now let us see why we need speech therapy. So children with speech and language delays are at high risk of difficulties in reading, writing, and spelling. So usually when we see children who are struggling readers, they would have had a history of late talking. Okay, they would have spoken late during their childhood. Okay, so though whoever speaks late, they have a high risk of difficulty developing problems in reading, writing, and spelling. And also, children with communication difficulties are more likely to have behavioral difficulties also. So I already told you that if the child is not able to communicate, then the child would be irritable, frustrated, and throw a lot of temper tantrums also. And speech therapy is important because speech and language and communication is important in forming friendship. So if the child is not able to communicate well, then the child will not be able to make friends. Okay, so then self-esteem and
देखिए
confidence
भाभी,
is
आप
also
दुखी क्यों हैं कि आपका बैंक में
affected
अकाउंट में
in
पैसा है, वो इनकम
children
कम हो गया?
who
अरे
have
भाई, वो
speech
पूरे
and
वर्ल्ड में
language
वो कंडीशन है,
difficulties.
आपके सिर्फ ये नहीं है.
Now, let us see what you can do as parents to help the child with speech and language difficulties or speech and language delay. So, these are just some tips. These are not a substitute for a speech language pathologist. If your child has a speech and language delay, you need to go and consult a speech language pathologist. So let us now see some of the tips as to what you can do as parents. I will be playing a video and explaining in between.
It's important that you get down to your child's level so that you're both looking and talking about the same things. Make eye contact with your child to let them know you're listening and that you want to interact with them. For example, if your child is lying down on the floor playing, lie down beside them and join in with what they're doing. You'll notice what your child is paying attention to, and you will relate to each other much more easily.
So the first tip is that you have to play with your child. Okay, so you have to get down to the level of the child. The floor is the best way in which you can get down and play with the child. And it is also here I would like to stress that you should give your time to the child. So many a times I have noticed that if a child is throwing temper tantrums and is irritable or is crying for attention, parents just give their iPhone or tablet or whatever computer, and they so that the child watches videos and just shuts up. This should not be done. When the child is demanding your attention, you should give your attention. You should play with the child or communicate with the child as to what is the problem. Okay, so next tip is to when you are doing some play activity with the child, you have to make sure that you comment on what you are both doing or what you are both looking at.
Children start to understand words by hearing them used over and over again. Talk about things that you can both see. Use simple language to describe everyday things that you're doing. You can then start to extend your child's language by adding in more words. For example, start by saying, "It's a dog," before expanding to say, "It's a big dog. The dog is barking. It's a noisy dog." Your child will then start to pick up new words to use for themselves.
So here we saw that we have to start off with simple sentences. Then we have to go on expanding that simple sentence. Okay, so in this example, they said that if you are both looking at a dog, then you say that it's a dog, and then you add the word big to it. So it's a big dog, or it's a noisy dog, etc. Okay. So this technique is called expansion. Okay. Next, we will see about modeling.
Listen to what your child has to say and repeat back to them, modelling simple phrases. You can add in any missing words or pronounce sounds in the right way. This gives your child the opportunity to hear how words should sound. It's important to model words in this way. This is different from correcting their speech. You're not telling your child they've said something wrong. You can simply repeat the words back to them. This will let your child know that you've listened to them, as well as helping them to pronounce words correctly in the future.
So in modeling, we are just giving a correct model as to what the child should say. So here you're not correcting the child. You're not saying that, okay, you said this wrong. This is how you should say it. You just have to repeat what the child is trying to say in a correct manner. That is modeling. So that is one of the techniques that can help the child with speech and language difficulty to develop adequate language.
It's been proven that dummies can reduce the risk of cot death in babies up to 12 months. However, after 12 months, dummies aren't needed during the day. Using a dummy affects a child's speech and language development because dummies in mouths mean children can't produce speech sounds correctly. It's important for your child to be able to communicate with you and not have to talk with a dummy in their mouth. Give your child different options so that they can make choices for themselves. This will allow your...
So this is another technique, speech and language stimulation techniques, we call it. So what you can do is you can ask the child, like, do you want an apple or do you want a banana? So that the child learns that, okay, this is an apple and this is a banana. So you are giving choices. The child can be free to choose whatever the child likes, and also the child's language is also developing simultaneously.
Child to develop their shared communication and interaction skills, which is key to language development. You can encourage your child to make choices in everyday situations. For example, if you're at a park, ask your child whether they would like to play on the swings or play on the slide. Then make sure you give your child enough time to consider the question and make up their mind. Smartphones, tablets and TVs can be great educational tools for children. However, it's important to remember that screen time does not replace talking with your child. When the TV is on, watch it with your child, join in with the songs and play the games together. But make sure you turn it off afterwards and engage in a conversation. Screens can often distract from real life interaction, which is far more important. Share books.
So as I already told you, to you console a crying baby, I've seen parents give their smartphones or tablets so that the child can watch whatever they want. So this should not be done. The screen time is not an equivalent to real life conversation. Okay. Next tip is that you can read books to your child and sing nursery rhymes to the child. So let us see about this tip.
With your child and talk about the pictures as you go through. Try and choose books about everyday activities and read the same ones over and over again. This will help your child understand sentences and how to use words correctly. Sing nursery rhymes and encourage your child to join in with the actions. You could also come up with your own nursery rhymes about everyday things that you're doing. Try and leave pauses for your child to fill in the gaps themselves. Give your child the opportunity to play and explore them.
Sorry for interrupting the video, but when you are reading a book to the child, don't bring a very complicated book with a lot of words in it. But if you are reading to a very young child, choose a book that has a lot of pictures and less words in it, and then so that you need not read not only read what is written there, but also you can point to the pictures and talk about that. Okay, you can talk about what is happening in the picture, what is there in the picture, what color it is, etc. So this way you develop the child's language also.
Give your child the opportunity to play and explore, then follow their lead. Watch to see what they're looking at or playing with, and then talk about it with them. Make sure you listen to what they have to say and then repeat it back to them. You can extend the vocabulary to help them pick up new phrases.
So we have to always make sure that we follow the child's lead. That is, we talk about what the child is doing and what the child is looking at, so that we follow the interest of the child. We don't try to impose what we want the child to learn, but we have to follow the interest of the child. Then learning would be more effective.
Playing games is a great way of developing your child's attention and listening skills. Make sure you put aside time in your day to stop what you're doing and play with your child. This could just be 5 or 10 minutes of one-to-one interaction at home.
So playing with your child is very important for the speech and language development of the child. So even if it is for 10 or 15 minutes in a day, if you do that, the child's speech and language would improve to a great extent.
Questions can be hard to understand. Try to reduce the number of questions you ask your child and comment instead. Give them the words to use. For example, rather than asking, "What is this?" say to your child, "This is a teddy bear." Try the 5-finger rule. For every question, back it up with 4 comments. Make sure you emphasize the object words in your sentences. This will help them to enhance their vocabulary and think about the words that you say. The language development.
So I have seen a lot of parents of children with speech and language delay. They just go on asking the same thing over and over again to the child as to what is this, what is this, what is this. So that you should not do that. You please refrain from doing that. Instead of that, you ask one simple question, and then as it was shown in the video, you, for every question, you add 4 comments from your side. Okay. So there should be less questions and more comments from you, so that the child learns to speak. The child gets an appropriate model as to what to speak.
Development pyramid shows us the different communication skills that children develop. It's important to understand that foundation skills such as attention and listening are really important for the development of skills higher up the pyramid. Playing games and interacting with your child in ways that provide an opportunity and reason to communicate will help to develop your child's attention and listening, understanding, vocabulary, and turn-taking skills. These skills are just as important as being able to say words clearly. Playing with your child is a really important way to improve your child's language development. Remember, you are your child's best teacher.
So I would like to emphasize the last sentence, that is, you are your child's best teacher. Even if you take the child to a speech language therapist, you would for a maximum spend half an hour or 45 minutes or 1 hour to the max with the speech therapist. But you are the one who spends a lot of waking hours with the child. So you have to work with the child. Please don't feel that you take the child to a speech therapist and the child starts somehow magically speaking. It is your effort as parents that is very important in developing the speech, language, and communication skills of the child. Okay. I would like to answer some of the frequently asked questions. Okay, so I get a lot of people who come to me with a lot of speech and language problems that their child is facing, and the first question that I get is, can we wait? Will the child learn to speak by himself or herself? Well, what I would suggest is that we do not wait, because we don't know for sure whether this child will learn to speak automatically. Because if it gets delayed, if the child reaches puberty, or even if the child reaches 9 years or 10 years of age, then it is very difficult to teach speech and language at that age, because the child's brain would have matured, and it is very difficult to teach new skills at a later age. So I would suggest, as soon as you feel that your child might have a speech and language problem, you consult a speech therapist and get help. And it was already stressed upon in the video, and I had already mentioned that screen time, it is best if you reduce it, if you show less and less of screen time, but more and more of real life interaction with the child, real life playing with the child. So I'll just share a study with you, which says that for every 30-minute increase in screen time, there is a 49% increased risk of the child developing an expressive language delay. Okay. So here again, I would like to stress that instead of screen time, I would say that you interacting with your child is very important. And another frequently asked question is exposure to more than one language. So if we talk in 2 or more languages with the child, so will it lead to a speech delay? No. If the child is a normal language learner, then you can speak to the child in 2 or 3 languages. So that is not a problem. In fact, children who learn more languages are better at their communication skills, and also in their cognitive skills in the sense in their intelligence. But if your child is having a problem, it is not because of exposure to more than one language. It could be because the child inherently has a speech and language problem. Okay, so if your child has uh, a speech and language problem, then we would suggest that you use one language with the child first, then you teach another language. So if there is a problem, then you start off with one language. But it is okay if you add a few words from another language as well, but it is important that you mainly communicate with the child who has a speech and language problem in one language. Okay, so finally, as a final note, I would like to say that if your child has you as parents should recognize whether your child might have a speech and language problem. Then the another important aspect is that you should accept that your child might have a speech and language problem, because unfortunately there is a lot of stigma attached to this speech and language difficulties, and getting help, people feel that it is a shame or it is embarrassment that uh, their child is going to a speech therapist. No, it is not. Please do not think as to what others might think about you. These others do not come and help you at your when you need help or when your child needs help. So please let go of the stigma attached to bringing your child to a speech therapist, and whenever there is need, please get help. Thank you. So this is the end of my talk. So tongue tie, yes, tongue tie definitely affects speech. It mainly affects the pronunciation, but not the language part. That is not understanding or how much a child speaks. That is not affected by tongue tie, but how clearly a child speaks is affected by tongue tie. So if your child has a tongue tie, then you should go to an ENT surgeon and visit a speech language therapist as well. Child is stuttering, then you should definitely get help from a speech language therapist. Okay. So the speech language therapist will determine whether it is a normal part of development, since your child is 3 years, the child is very young. Okay, it could be something that would go away, or it could be a problem. So you have to consult a speech language therapist.
Yeah.
And then the speech if there is a stuttering problem, then your speech therapist will teach your child how to speak a different way of speaking, and then if you follow that, I think the stuttering problem will be resolved.
Yes.
You better do these activities in the guidance of a speech therapist. What you can do is you can take a bite block or something, and then you can ask the child to bite on it. Okay, and then rapid opening and closing exercises, and keeping the mouth open for 10 seconds or 15 seconds. All these exercises can be done for jaw strength, but I think you should go to a speech therapist and determine what exactly is the problem, whether jaw opening or jaw closing. So if jaw closing is a problem, then you need not work on jaw strength. Okay. Well, we cannot determine in terms of stuttering. Sometimes we do not know the cause. But as I told you, there are some risk factors like being born prematurely, or no birth cry, or low birth weight. That could be some of the causes. Okay, that needs to be probed, and then only we can say, or many a times we cannot pinpoint the cause also. So if your child is stuttering at the beginning of a sentence, you need, I would say that you need to consult a speech therapist and go for speech therapy. There is no maximum age.
Okay.
As such, you can consult a speech therapist at any age, even adults. But as the child's age increases, the amount of improvement that would that we can see would be less. And if the child's age is more, then we have to put in more effort to teach the child, as compared to if a child is young.